Hi, I'm Tammy Johnson. I'm going to be showing you the blood pressure skill, the pulse, and the respiration. I do want to talk for just a minute about that it is not, you don't have to do this, but I highly suggest that you do buy your own blood pressure cuff. You can get one at a local store, pharmacy, Walmart. Runs anywhere between $12 to $15. You can get really pretty colorful ones off of Amazon, have them delivered the next day. This is so that you can practice this skill at home. You will need to practice this skill at home. Although in the beginning, you will not know whether the numbers are correct or not. But what I'm wanting you to do for now, until we can do this in person, is to practice on listening. So that's the focus for this. So if you can, I highly suggest that you get your own blood pressure cuff. Also, I want to mention the one at Walmart, the one on Amazon comes with a stethoscope. So that is $12, $15 at the most. You get both. And something you can use in your nursing school too. So we're going to talk about the pulse. Now this is the exact, almost the exact same equipment that you will do when you go into your state test. So you have your arm, and we're going to talk about the pulse. The pulse is on the thumb side. You must have your fingers on the thumb side. This is called the radial pulse. Please remember that, because that could be on a test question. You're going to have 3 fingers, you're going to have your thumb, and you're going to press down. And on this mannequin, the pulse beats are very strong, and they beat, and you can feel each beat very strong. You will count each beat for 30 seconds. You will have your watch on. So this is what I kind of suggest you do. You feel it, you get the rhythm, you start when you're ready to time yourself for 30 seconds, and then you just sit here, kind of look down, and count your beats. You just glance at your watch, and when you get to the 32nd, whatever number you're on, you take that, you write that number down. I got 30, so I'm going to double that, and I got 60 beats, and that is what you will write down for the instructor to come and look at. You have to be within 4 points of what she gets, and you'll be okay. So that is the radial. And now we're going to talk about the blood pressure. I want to talk about holding your bulb that you pump the cuff up with for just a second. Well, let's go to the cuff. It is on, but when you're doing this at home, I want to make sure that you put this cuff on above the brachial. Now that's the pulse that's in the bend of the arm, so you want it above, and that way you will have the brachial to put your stethoscope on. So the cuff obviously is already on here, but I just wanted to tell you that if you're practicing at home. You hold the bulb like this. We do not hold it like a grenade. We do not hold it up against us. I see this a lot. You hold it relaxed in your hand. If you're right-handed, and most people use the right hand for the pumping up, is you turn the dial. This dial right here turns toward your thumb. Don't turn it too tight, or you're going to have trouble when you try to release it. So toward your thumb means that it's ready to pump up. Now I want to talk to you about the dial. I'm sure you probably can't see as well as I'd want you to, but again, we'll do this in person. It should start on, well, it's right in the middle. It's not really a 0, but it's right in the middle. Your next number's 20, 40, 60, 80, and you have little dots or little slashes between that, and those are 2 points each. It is impossible to get an odd number on blood pressures. So if you start at 20, then it goes 22, 24, 26, 28. Then the line that's between the 20 and the 40 is 30. This is in detailed in your vital sign chapter, textbook, and workbook. Highly suggest that you study this in your textbook and your workbook even before you work on the arm. So be sure that you're paying attention to this. When you're first learning this and you have your blood pressure cuff at home, you can look, but I want you to practice on listening. Once you get the listening done, then you can work on the numbers, okay? What I like to do in my class, when we do get back together, is I like to sit down with each and every one of you and watch you do this skill. So be sure and practice on that before, okay? So this is usually on a blood pressure cuff, is usually attached up here. I like to lay it down here where you can see it, and it also unattach on your your set that you buy. So I've got that where I can see it. Now I want to talk about the stethoscope. You will be using a double-headed stethoscope so that the instructor can listen as you listen. So I'm just going to kind of isolate it here and show you your part. You've got the earpieces, and see how they're bent just a little bit? You want them facing out. What you really want is for them to be comfortable for you, but they move a little bit, and you can point them out. Then you take this diaphragm part, and you have to watch because this turns. This part right here turns almost on every stethoscope, not all of them, but most of them. And if it's turned off, you will not be able to hear. So gently, when you have it in your ear, tap and see which side's louder, because that's one of the most common mistakes that I get on this skill is this: I can't hear, Miss Johnson, and it's because it's not on. Also, getting the cuff tight is very important too. You also will need to clean the earpieces with an alcohol wipe and the diaphragm. So before I put this on the mannequin, I want to show you that we talked about the radial. Now this is the brachial. I personally, when I'm trying to find a brachial, I kind of line it up with the pinky. I go over, notice how I've got my fingers up, and I put 2 fingers here, and I feel the brachial. The mannequin arm does not have a brachial, but I still want you to do this so that you can learn to do it on our residents. So I feel, and that wherever I feel is where I'm going to place the stethoscope. So I'm going to go through this for just a minute and let you watch how I do it. So I'm going to put it in. Before I put them in my ears, I want to talk one more thing about this. Very common mistake is how to place that on. It should look like this, 2 fingers on each side. I do not ever want to see you put your finger over this, your thumb. I've seen this mistakes on TV, medical shows a lot, and you will catch it now too. So remember, just put your 2 fingers there, put the earpiece in. And then I will pump this up to whatever I want to, usually around 180, 160. Letting it out, and I'm listening. And just keep letting it down, and I'm letting it down, and then let it all the way out. Once you get it pumped up, let me show you on this. I'm not sure how much you can see, but pump it up, and when you start listening, the very first beat that you hear, very first sound that you hear is your top number. Take note of that in your head. Go ahead, and you're going to continue, and it's going to get softer and softer and softer. The very last beat that you hear is your bottom number. Always let the air completely out. You will take your ink pen or pencil, and you will write down the top number you got with a line over it and the bottom number. All this is in your textbook and your workbook. And again, we will do this together. And that is the number that you will give her. This needs to be within 4 points of the top number and 4 points of the bottom number. So in the beginning, I would really want you to just listen. Practice on listening and then work on your numbers. Again, there is no odd numbers. There is no 105 on here. There's no 101. There's not a 93. It has to be even numbers. So that is the blood pressure skill. So now I'm going to talk about the respirations. Respirations is when we breathe in and when we breathe out. The instructor will sit calmly, quietly in a seat, and she will breathe. She'll breathe in and she'll breathe out. When you breathe, she breathes in, she breathes out. That's one count. One count, okay? In and out is one count. You will do that as we did the pulse for 30 seconds. So, you'll get your watch. If you want to, you can get the second hand, get on the 12, start. In and out is one. Count them for 30 seconds. Write that number down. Double that number, and that number is the number you give the instructor. And again, you have to be within 4. She will be dramatic. You will be able to see her breathe. It is not usually a problem at all. I do want you to know that you have to count if the pulse or the respirations are irregular. Count them for a full minute. We will go over this in more details. The numbers, the normal numbers for all these are in your book. Thank you.